Good evening, everyone. So my next topic of discussion, which I'm going to discuss with you, is on beta-lactam antibiotics, that is penicillin. In this video, I'm going to discuss with you penicillins, various types of penicillins, and now I'm going to start the beta-lactam antibiotics. And before I start my video, I want to request you, if this video appears useful to you and if it is helpful to you, kindly subscribe to my YouTube channel, that is Dr. Nitika Han's Pharmacology Discussion. So beta-lactam antibiotics, penicillins. Now, what are the beta-lactam antibiotics? First of all, these are the drugs which have the beta-lactam ring in the structure. This is the four-sided ring with carbon atom on its sides and four carbon atoms, and this ring, the second ring, is also present in this. These are penicillin, cephalosporins, carbapenems, and monobactams. This four-sided carbon ring is present in all of these type of the penicillins. There is penicillins, cephalosporins, and carbapenems and monobactams. And the second ring is different in all of them. The beta-lactam antibiotics, that is penicillin, cephalosporins, carbapenems, and it is absent in the monobactams. The second ring is absent in the monobactam. Only this ring is present in the monobactams. And the second ring is different in all the three types of the drugs, like penicillin, cephalosporins, and carbapenems. Antibiotic and antimicrobial. Now, what is the difference between antibiotic and antimicrobial? Now, antibiotic is a substance which is obtained from microorganisms and which kill and inhibit the growth of the other microorganisms. These are obtained from the microorganisms. Antimicrobial is which inhibits the agent which inhibits or kills the growth of microorganisms, but it is not obtained from the microorganisms. It can be obtained from plants, animals, fungi. Means these are obtained from plants and animals. These are not obtained from the microorganisms that are antimicrobial agents. Now, some definitions. Disinfectant is the antimicrobial agent which acts on the inanimate objects. Chemotherapeutic agent, antiseptic, antimicrobial agent that can be used eternally. Means it is also the antimicrobial agent which can be used in living tissue. In the living tissue, it can be used internally. Bactericidal is the microorganism or the antimicrobial agent which kills the bacteria. Bacteriostatic is which inhibits the growth of bacteria. And basically, when we give the bacteriostatic drug, the growth of the bacteria in the body gets inhibited, and the immunity of the body acts on the other leftover bacteria, and they will kill other bacteria also. They will inhibit the growth of the other bacteria also. But in immunosuppressant patients, bacteriostatic drugs does not act. We give the bactericidal drug which kills the bacteria. Selective toxicity, a drug that kills harmful microbes without damaging the host. Now, how antibiotic works? It can work by acting on the cell wall synthesis. This is bacterial cell wall. It can occur. It can act on the DNA, like DNA gyrase can be affected, like in case of fluoroquinolones. It can disrupt the cell division. DNA replication can be inhibited. And it can also inhibit the synthesis of proteins by inhibiting the RNA function. It can affect the metabolism. So folic acid synthesis can be reduced. The metabolism of the bacterial cells can be affected. And these are the various antimicrobial agents, antibiotics, which can be inhibitors of metabolism are sulfonamides and trimethoprim. Inhibitors of cell wall synthesis are beta-lactams, vancomycin, and other bactritacin, cycloserine, and phosphomycin. These are also the cell wall synthesis inhibitors. Inhibitors of protein synthesis are tetracycline, aminoglycoside, macrolides, clindamycin, chloramphenicol. And inhibitors of nucleic acid, that is DNA, acting on the DNA gyrase, they are fluoroquinolones and rifampicin. Now, the inhibitors of cell wall synthesis, these are the beta-lactam antibiotics, and these can be divided into the penicillins, cephalosporins, carbapenems, and monobactams. And these penicillins I'm going to discuss in this class with you, and the beta-lactamase inhibitors I'm going to discuss with you. These are the various penicillins given, and the beta-lactamase inhibitors are clavulanicases, albectum, tazobactam. Now, the difference in the second ring structure determines the structure, the name of the penicillin or the beta-lactam antibiotic. That is the penicillin nucleus, cephalosporin nucleus, and monobactam, which has only one ring, and the carbapenem. The difference in the chemical structure of the second ring determines the name of the beta-lactam antibiotic. Now, what is penicillin? It is an antibiotic. It was discovered by Sir Alexander Fleming in 1928. Nobel Prize with H.W. Florey and E.B. Chain. He got Nobel Prize for it. The name penicillium comes from the penicillus brush, and this is based on the brush-like appearance of the fruiting structures. Now, the most common type of the penicillin is the penicillin G. It is the natural penicillin, and it is not effective orally, basically, and it's mostly given intravenously, very less, or it is because it is acid labile. And gram-positive bacterial cell, it is inhibited, like N-acetyl glucosamine and N-acetyl muramic acid cross-linked with peptide chain, the synthesis get inhibited. Transpeptidase outside cell membrane found. Means transpeptidation between the N-acetyl glucosamine and N-acetyl muramic acid will be inhibited, or it will be broken down, and then the cell wall synthesis inhibition takes place. Now, this is the nature of the R group, determines the drug stability to enzymatic or acetic hydrolysis and affects its antibacterial structure. This R group is the responsible for its acid lability, and it's a hydrolysis in the acid, and site of cleavage by bacterial penicillinase or by acid is this here. This is the site of cleavage of the penicillinase. Penicillinase is the enzyme which breaks down the drugs, that is penicillins, the beta-lactam antibiotics, and thus make the drug not acting, because it is produced by the bacteria. Penicillin's enzyme, it will inhibit the function of the beta-lactam antibiotic, that is penicillin. It will cause a breakdown of penicillin, and so penicillin becomes ineffective. Antibacterial spectrum is mostly these are affected against gram-negative and gram-positive bacteria, and gram-negative to some extent, like gram-positive foci like staphylococci, streptococci, gram-positive bacilli like corynebacterium, diphtheria, listeria, actinomycosis, these are basically affected. And gram-negative, in gram-negative foci are the drugs which can be effective, like gonococci, meningococci, and other drugs. These are not effective against the gram-negative bacilli like Klebsiella, Pseudomonas, or E. coli, Proteus, Salmonella. These are not effective against gram-negative bacilli. Most healing of these respiratory tract infections, these are effective, and these are responsible for treatment of bacterial diseases, that is penicillin G. And these are very effective, and they have very few side effects. And the most common side effect is the allergic reactions or anaphylactic shock with penicillin. Mechanism of action of penicillin is this binds to specific receptor, and it inhibits the transpeptidation. That is N-acetyl glucosamine and N-acetyl muramic acid cross-linking does not take place, and transpeptidation is inhibited, and they will inhibit the synthesis of peptidoglycan and cause the lysis of the bacteria by stimulating autolysis. Inhibition of cell wall synthesis to inactivate transpeptidase interfere with the biosynthesis of the peptidoglycan. And to inactivate penicillin binding proteins present on bacterial cell membrane, which are bacterial enzymes involved in cell wall synthesis, and maintenance of morphological features. The number of penicillin binding proteins vary with the type of organism. These penicillin binding proteins, they get inactivated. These are the enzymes involved in cell wall synthesis. Means they will inhibit the transpeptidation, and they will also inhibit the penicillin binding proteins, which are responsible for cell wall synthesis in the bacteria, in the gram-positive bacteria. They target the penicillin binding proteins, the penicillin, and they inhibit the biosynthesis of peptidoglycan. This is the diagram showing N-acetyl glucosamine and muramic acid undergoing transpeptidation, and this transpeptidation is inhibited by the penicillins. The same diagram. Cell walls of bacteria are essential for their normal growth and development. Inhibition of transpeptidases cause spheroblast formation and rapid lysis. Because when transpeptidation is inhibited, there will be formation of spheroblast and there will be lysis of the bacteria. This transpeptidation reaction is Staphylococcus that is inhibited by penicillins and cephalosporins. Now, antimicrobial resistance, relative or complete lack of effect of antimicrobial against a previously susceptible microbe. This microorganism is susceptible to penicillin, and the penicillins, they become the bacteria now become resistant to the action of penicillins, and this resistance of the antimicrobial agent against the penicillins, that is beta-lactam antibiotics, this is antimicrobial resistance. Penicillinase, a specific example, cephalosporinase, plasmid via bacteriophage. Gram-negative bacteria has less beta-lactamase but is located in periplasmic space near transpeptidase. So penicillinase is the enzyme present in the bacterial cell wall, periplasmic space, and it is responsible for breakdown of the drugs, that is penicillins or cephalosporins, and these cause a breakdown. So lysis will lead to inactivation of the action of the drug. Penicillin binding proteins can be affected with it. With poor affinity, the penicillin binding proteins can be affected. That can lead to inhibition or the antimicrobial resistance. Absence of porins. Porins are the structures which are responsible for the intake of the drug into the bacterial cell wall. When the porins are absent in the cell wall, like Pseudomonas aeruginosa, gram-negative bacteria with porins through which ampicillin, amoxicillin, cephalosporins diffuse. Now, when there is porins absence, that can lead to antimicrobial resistance. And these are present in gram-negative bacterial cell walls, like in, and so ampicillin, amoxicillin, cephalosporins, they can be affected. Now, the presence of efflux pumps. There can be efflux pumps which will efflux the drugs from inside of the bacteria to outside, and that will lead to resistance of the antimicrobial agents. This is the same diagram showing the beta-lactam resistant cell wall transpeptidases, means this penicillin binding proteins, these get resistant, and beta-lactamases which will inhibit which will break down the beta-lactam antibiotics, and beta-lactam efflux pumps which will influx the drug from inside to outside. Now, penicillin, when it acts on the penicillinases, by the penicillinase, it forms the penicilloic acid, and thus the action of penicillin becomes stopped. This is effective, this is gram-positive, excrete beta-lactamase outside the cell wall. Gram-negative, small amounts of beta-lactamase in periplasmic space. Gram-positive bacteria, they excrete a lot of beta-lactamases, but gram-negative, they excrete a small amounts of beta-lactamases, need less beta-lactamase to be resistant. This is the difference between gram-positive and gram-negative bacterial cell wall. There is lipopolysaccharide and protein layer in the gram-negative, and peptidoglycan and a cell membrane is same. This is the cell wall of the gram-negative bacteria, periplasmic space, cytoplasmic membrane, cell wall, porin present in the outer cell wall in the lipopolysaccharide layer. Effective against rapidly active growing organisms that synthesize peptidoglycan. These are effective against the rapidly growing organisms, and inactive against organisms lacking mycobacteria, lacking it. This is these are effective only in the organisms which have the peptidoglycan, and these are not effective against the organisms which lack the peptidoglycan, that's mycobacteria, amoeba, protozoa, fungi, viruses. These are the classifications of penicillins. These are the normal original penicillins like benzathine penicillin, procaine penicillin, penicillin G. Semi-synthetic penicillins are the penicillinase resistant penicillins. These are penicillinase, the beta-lactamase resistant penicillins. These are methicillin, cloxacillin, dicloxacillin, oxacillin, neficillin. And extended spectrum are which are having the wide spectrum of activity. They're effective against gram-negative bacteria also, like amino penicillins, like ampicillin, amoxicillin, and carboxy and ureopenicillins. And beta-lactamase inhibitors are the drugs which are given along with penicillins and which will inhibit the beta-lactamase activity, and thus the penicillins are effective in action. These are clavulanic aces, albactam, and tazobactam. This is the uses of the penicillins. Penicillins are effective against gram-positive cocci, gram-negative bacilli, and gram-negative cocci. And these are gram-negative bacilli, most are resistant. So these can be effective against staphylococcus, streptococcus, and bacillus, clostridium, corynebacterium, listeria, and Neisseria gonorrhoeae. So gonorrhea can be treated, and in the same way, syphilis can be treated by Treponema pallidum, spirochetes, and pneumococcal pneumonia can be treated by Streptococcus pneumoniae action by killing the Streptococcus pneumoniae. So these are the uses of the penicillin G and penicillin B. I've already told you this can be used in Neisseria meningitis, Streptococcus pneumoniae, bacterial meningitis, bone and joint infections caused by Staphylococcus aureus, skin and soft tissue infections caused by Streptococcus pyogenes, pharyngitis caused by Streptococcus pyogenes, and otitis media caused by Streptococcus pyogenes. The penicillin G can be effective. Bronchitis, mixed infections, commonly amoxicillin, which is the extended spectrum penicillin, it can be given. Pneumonia, urinary tract infection with Escherichia coli, amoxicillin is effective. Gonorrhea, amoxicillin plus propane acid is given. And syphilis, procaine, benzyl penicillin, benzathine penicillin is effective. Endocarditis, and serious infections with Pseudomonas aeruginosa, we give the drugs piperacillin. Penicillin G, it is given mostly intravenously. It is orally ineffective because it is acid labile. It, in the presence of acid, it gets broken down, and excretion is by the tubular secretion mostly, and it mostly gets secreted. So we have to combine it with propane acid. When we combine the drug with propane acid, most of the propane acid gets excreted down, and this penicillin remains in the body. And so these we can give them in intrathecal administration also. Penicillin can be given in pneumococcal infection. We can give cephalosporin and vancomycin. Pneumococcal pneumonia, pneumococcal meningitis, we can give vancomycin, third generation cephalosporin, and rifampicin. Streptococcus infection, streptococcal pharyngitis, we can give the drug penicillin B, 500 milligrams 6 hourly, 10 days. And streptococcus pneumonia, arthritis, meningitis, endocarditis, penicillin G is effective. Anaerobes, we can give in the infection of the anaerobes, we can give penicillin G. In brain abscesses, penicillin G and metronidazole and chloramphenicol is effective. In staphylococcal infections, they produce penicillinase using cloxacillin. So aminoglycos, they produce the penicillin. So penicillinase resistant penicillins are given in staphylococcal infections like cloxacillin and aminoglycosides. In methicillin resistant Staphylococcus aureus infection, we give the drugs that is vancomycin. Meningococcal penicillin G is the drug of choice in the pneumococcal meningitis, and in gonococcal the penicillin G again it is resistant, And ceftriaxone is a drug of choice for the gonococcal Neisseria gonorrhoeae, gonococcal infection, Neisseria gonorrhoeae, or gonococcal cervicitis. We give ceftriaxone. Syphilis, we give the benzathine penicillin and the procaine penicillin can be given. Actinomycosis, penicillin G, 12 to 20 million units can be given. Diphtheria, we give procaine penicillin or erythromycin. Anthrax, we give penicillin G. Clostridium infections, we give the penicillin G. Fusel spirochetal infection like gingival stomatitis, we give penicillin B. Rat fever, we give again penicillin G. Listeria infection like Listeria monocytogenes, penicillin G is effective. Lyme disease, tetracycline amoxicillin is effective. Erysipeloid tricks, benzathine penicillin is effective. Prophylactic juices can be in streptococcal infection. Again, we give benzathine penicillin. And rheumatic fever, we give penicillin G or penicillin B, or benzathine penicillin can be given. Gonorrhea, we give the penicillin G, or we can give the ceftriaxone or azithromycin can be given. Syphilis, we give the ciprofloxacin or ceftriaxone, or benzathine penicillin can be given. Valvular heart disease, penicillin G is given. Now, penicillinase resistant penicillins, methicillin, nephacillin, these are parenteral. These are the penicillin resistant penicillins. And these methicillin resistant microbes altered penicillin binding protein. Example, staph, epidermis, staph aureus. Choice of drug is vancomycin in the methicillin resistant staph aureus infection, with or without rifampicin. Now, these are penicillins as well as acid-resistant anti-staphylococcal. These are penicillinase-resistant penicillins, methicillins, nephacillin. Potency, nephacillin is more potent than diclofenac, cloxacillin, and oxacillin. S is stable but variable GIT absorption. Nephacillin educates CSF concentration, hence preferred in staphylococcal meningitis. Amino penicillins, these are extended penicillins, or carboxy penicillins, or amino penicillins, or uridopenicillins. These can be ampicillin, amoxicillin, becampicillin. These are having the wide range of narrow, broad spectrum activity, effective against gram-negative bacteria also. These are effective against Haemophilus influenzae also, Enterococci also, Neisseria gonorrhoeae, Proteus mirabilis, Salmonella, Shigella. Enterobacter are not sensitive to mono-based penicillins. Examples, Pseudomonas, Serratia, Klebsiella, Acinetobacter. Ampicillin and amoxicillin can be given. Indications of amino penicillins are urinary, upper respiratory tract infection, urinary tract infection, meningitis, salmonella infection like typhoid, gonorrhea, cystitis, subacute bacterial endocarditis, septicemia, or mixed infections. Amino penicillins like ampicillin and amoxicillin can be effective in these infections. Anti-pseudomonal penicillins, these are carboxy penicillins and uridopenicillins effective against the pseudomonas. So these are carbapenicillin, ticarcillin, mesglocillin, piperacillin. These are effective against gram-negative bacteria and immunologically impaired with glycosides. Bacteremias, pneumonias, burn infection, UTI resistant to penicillin G and ampicillin enterobacters. These are effective against pseudomonas basically. And UTI, which is resistant to penicillin G and ampicillin, we can give them. Penicillin ADRs they can cause the hypersensitivity reactions, they can cause rash, fever, bronchospasm, vasculitis, serum sickness, exfoliated dermatitis, Stephen-Johnson syndrome, and anaphylaxis. 10% cross-checked with cephalosporins. Means if the sensitivity of the patient is having sensitivity to penicillins, they will be also having the sensitivity to cephalosporins. Anaphylaxis. Now this can be, we can test these sensitivity or the allergic condition, anaphylactic reaction of the penicillin by giving the intradermal drug sensitivity testing. Intradermal is given, and if within half an hour the allergy appears in the body, then we do not give the penicillins to the patient, and also the other drugs like cephalosporins, carbapenems are prevented. But these are not resistant to this cross activity is not seen with monobactums. We can give the monobactums to the patient, and that's all. Other areas can be bone marrow depression, granulocytopenia, hepatitis, impairment of platelet irrigation, there is bleeding, pain, sterilipsis. Superinfection, Pseudomonas colitis can be there. These are the beta-lactamase inhibitors. These are clavulanic acid, tazobactam, sulbactam. These are given with the these inhibit the beta-lactamases of gram-negative bacilli, Staph aureus, and bacteroids. Clavulanic acid, it can be given with ampicillin. Sulbactam is given with amoxicillin. Sorry, clavulanic acid is given with amoxicillin. Sulbactam is given with ampicillin, and tazobactam is given with piperacillin. And these are effective against the Staph aureus and gram-negative aerobes, sulbactam, but not against Pseudomonas and anaerobes. Tazobactam has poor activity against the Enterobacteriaceae, but good against the beta-lactamase produced via plasmid. Thank you. That's all. I hope you understood my video. And if this video appears useful to you, kindly subscribe to my YouTube channel. That is Dr. Nitika Hans Pharmacology Discussion. And thank you for listening. I hope you understood this lecture. Thank you. Happy learning. Be safe. Be healthy. Be blessed. Happy learning. Be happy. Thank you.